My name's Amy Chidley. I'm employed by the perinatal department at Birmingham and Solihull Mental Health Foundation Trust as an expert by experience. I've also got a role at the Royal College of Psychiatrists as a patient voice rep and involved in NHS England on their perinatal co-production group. A bit of a mouthful. When I started working as a lived experience rep here, I was invited to join the quality improvement course run specifically for experts by experience. And I was just eager to do any kind of training that would help me do the role, and it sounded like an interesting thing. So I jumped on board with that. Okay, so experts by experience is anybody who's had an experience and therefore is an expert in it. So if you've had a mental or physical illness and you've lived with it for 24/7 for over years, you are certainly an expert in how it affects you. And as opposed to an expert by training, who will be a medical professional who's spent many years studying things and has a clinical experience and perspective on things. And as an EBE QI Advisor will be a member of a QI project who's bringing that perspective, hopefully their own perspective and perspective of other EBEs, to help the project bring professionals, health professionals and experienced professionals, if you like, into the same forum to create a project where we're hopefully meeting the needs of service users better. So the project I was first invited to be involved with was the perinatal equitable and timely access to perinatal services, which is basically about trying to cut down the waiting times from a referral to an assessment and to make that waiting time equitable across the different regional groups, because there was a lot of disparity before then between your postcode lottery sort of situation. Yeah, my experience has been really a great experience on my team. I've had a wonderful QI lead and great administrator who's been on the ball with everything, and then the manager from the perinatal team has also been really great, and they've accepted me as an equal member of the group. I've not felt that I'm not a clinician here or anything like that. I felt really valued, not just because of my experience, but also for my own skills as a human being, what I've brought from my past life, skills, academia, the way my brain works or doesn't work. All those things. There's been no sort of sense of hierarchy. We've each kind of enabled the other person to get on with their bit, brought it all together. There's been good communications, and it's been a really good experience. Yeah, empowering's a good word. I think a lot of people would say that when it works well. And also, I think if you are working in this kind of real sense of co-producing as opposed to just consulting, then you're learning so much more about each other. So I think as a lived experience person, when you first come into things, you're thinking, right, I'm there to tell them what we need. You know, as patients, this is what we think the service needs, and I can tell them because I've been there. But actually, we're also there to learn about how does the system work, how does the NHS work, and what are the challenges that the clinicians have, and the nurses and the healthcare assistants and everybody on board. They've all got their different challenges and pressures, and there are ways of doing things. So it's a really good relationship building exercise for both parties, if you like, and hopefully there isn't then a sense of them and us, but we're a team, and we can all bring something to this and learn from each other, and that's been really great for me, because I understand that now. That's why this has to happen, or that's why that can't happen, and so on, or that's why that takes so long, etc. It's really great, and just the sense that in the same meeting you can have, you know, one of the top clinicians on a band 8 with somebody who's a band 2, and there's the difference is nothing. We're all human beings. We've all got something to offer. I would say I'm just enjoying it. I've started helping out with another project which is linked to the other perinatal project, and this is a therapies project looking at how do we better provide more relevant interventions for each patient, looking at their specific needs, so that we're not kind of wasting their time and them getting more poorly. And I'm hopefully going to do a bit more of the QI training, and also I've been doing some training at the Royal College of Psychiatry for that, and we're going to be putting on a workshop for trainee psychiatrists on using co-production in QI and how completely invaluable it is. So trying to get people on board and to become sort of champions for QI within the Royal College of Psychiatrists as well. And yeah, I like the way it has a methodology to it. It's probably something to do with the way my brain works, but it's not wishy-washy, and it's not just about let's all try and be nice to each other, which is incredibly important. Kindness, but kindness that has a strategy too. Kindness and compassion and inclusion. There you go, got the trust values in there. Yeah, I love it. It's great.